एक्चुअली मेरी ड्यू डेट हो चुकी थी फर्स्ट बेबी के टाइम पे, और जो बेबी का जो हेड होता है वो फिक्स नहीं हो पाया था, तो इस वजह से डॉक्टर ने बोला था कि अब वेट करने का कोई रीज़न नहीं है, आप चाहें तो सिजेरियन करवा सकते हैं।
मेरा फर्स्ट सिजेरियन जो हुआ था उसका रीज़न था कि मेरी जो बेबी के 9 मंथ्स कंप्लीट होने से पहले ऑलमोस्ट 8.5 पीरियड में जो अल्ट्रासाउंड हुआ उसमें डॉक्टर ने बोला कि अब जो कॉर्ड है वो बेबी के राउंड नेक है, तो मे बी वो कॉर्ड फंस सकती है नेक में और इमीडिएटली ऑपरेट करना पड़ सकता है।
India is witnessing a new but disturbing trend. The National Family Health Survey 2019-20 has put in focus the sharp rise in caesarean deliveries, especially in private hospitals and clinics.
लास्ट मिनट पर अगर कॉम्प्लिकेशंस हो तो सी सेक्शन की तरफ जाया जा सकता है, उसमें कोई बुराई नहीं है। आजकल तो लड़कियां बाय चॉइस सी सेक्शन करवाती हैं। इसके अपने फ़ायदे भी हैं, लेबर पेन से बचा जा सकता है।
फ़ायदे इसके क्या है कि हम 24 से 48 घंटे में अपने घर वापस जा सकते हैं। सिजेरियन डिलीवरी में हमारा एक तो मतलब 4 से 5 दिनों तक हमको हॉस्पिटल में रहना पड़ता है, उसके बाद ही हम घर वापस जाते हैं।
जो इसका नुकसान है वो बॉडी पे आता है, आपका सीजर होता है बेबी, और बेबी थोड़ा सा प्री मैच्योर हो जाता है, आपकी बॉडी में थोड़ी वीकनेस रहती है टाइम तक।
प्रॉस एंड कॉन्स ऑफ सिजेरियन, मेरे हिसाब से मुझे कोई दिक्कत नहीं होती है, बल्कि मुझे ऐसा लगता है कि सिजेरियन ज़्यादा अच्छा है। आप अननेसेसरी जो पेन होता है एटलीस्ट आप उससे बच जाते हैं।
Women who have undergone caesarean section during delivery in general seem to be divided on the long-term effects. But experts seem to be clear that a lot many unnecessary C-section surgeries are taking place.
Normally the caesarean section should be 10 to 15%. Anything beyond 15%, WHO says that it is not going to get any added advantage for the health system or for the health of the mother. So anything beyond that, it appears that this is not all of them are not a necessary C-section. These are which can be avoided. Why this happens is very difficult to tell from NFHS survey, because whether it is there is a demand from the sections of the women, or whether it is from the because of the private hospitals, or whether it is from the supplier side, we really don't know those aspects of it. We can only just tell there are unnecessary C-section is happening, which can be controlled.
A normal delivery, also called vaginal delivery, happens through the vagina without any medical intervention. It is the natural way to give birth, and doctors say that organs of babies born through normal delivery are in general more mature. On the other hand, during caesarean section, a mother's uterus is cut open by a doctor and baby is taken out. This has come as a boon in those cases where complications are observed and the life of mother or the fetus could be at risk. Caesarean section can be planned in advance because of complications observed during pregnancy, or because the mother has certain risk factors, or it could be a last-minute decision because of certain emergencies observed during labor.
You cannot say that this person is fine. How can you say? Suppose all the cases are being referred to a tertiary care center, which is a difficult case, which is a problematic case. So how can you define that a 15% is fine? WHO itself has revised its criteria of this 15%, and whatever is best for the mother and child should be done.
However, it must be pointed out that although C-section surgery is extremely safe, it does come with usual side effects that are present in any surgical procedure.
C-section is not good neither for mother nor for the baby. If you ask a pediatrician, he'll say obviously a baby who comes out of the vaginal delivery, he has a mature lung, and the maturity level that is attained during that process of birth cannot be attained during C-section. So one is that the baby born by vaginal delivery, he is in optimal state. The C-section patients, they are not able to breastfeed their baby easily. It is very difficult for them because post-op pain is also there. So ultimately the morbidity of the mother is more. The newborn baby is less mature compared to a vaginally born baby.
सी सेक्शन एक मेजर सर्जरी मानी जाती है, उसके अपने कॉम्प्लिकेशंस होते हैं और उसके बाद नॉर्मल डिलीवरी के इंसिडेंसेस भी कम होते हैं और उसके अगर किसी डॉक्टर के थ्रू हो रहा है, मतलब किसी डॉक्टर ने उसको किया है तो बहुत अच्छी बात है, वेल एंड गुड, लेकिन अभी जैसे माल प्रैक्टिस भी है.
C-section can introduce new risks as well in the long term. For example, for mothers, there is a reported rise in the odds of depression and serious difficulties with subsequent pregnancies. For children, the subtle alteration in neonatal physiology can increase later incidence of obesity, asthma, juvenile arthritis, etc. Internationally, a rate of 10 to 15% C-section deliveries is found to be ideal to cover up for cases where there might be complications. In cases of assisted pregnancies and late-age pregnancies too, doctors prefer the C-section route. In Nordic countries, thought to have the best healthcare systems, caesarean sections have been found to be about 17% of all deliveries. A look at the data for 22 states shows that the majority of them reported over 50% C-section deliveries in private facilities. In 3 states of West Bengal, Jammu and Kashmir and Telangana, this number is over 80%. Gujarat has the lowest rate of C-section deliveries in private facilities at 31%. The latest NSO survey on the state of India's health finds that the overall share of women delivering through C-section has crossed 28%. But what is interesting to note is that the percentage of C-section deliveries in government hospitals is less than half of that at private hospitals in these 22 states. This lends credence to the argument that some private hospitals may be advising patients to go for the C-section as it helps them make higher profits. The starting cost of a C-section delivery can be anywhere between Rs 50,000 to over 1.5 lakh depending upon the city and the hospital. Premium hospitals offer packages of up to Rs 3 lakh and more. In any hospital, the cost for normal delivery would typically be less than half of that of C-section delivery. While some private healthcare providers may have a profit motive in suggesting C-section deliveries, the truth is that many middle-class mothers too opt to go under the knife just to avoid labor pain and to do away with possible last-minute complications. Doctors, however, are emphatic that there are many reasons for increase in C-section deliveries and the procedure has been helpful in preventing complications.
Many women, they start saying ki I don't want a normal delivery and I want a cesarean section. But there are two views regarding it. See, one view is that ki no, you have to counsel her that normal delivery will be better for you and you should go for a normal delivery because later on there won't be any remote complications of normal delivery. Whereas cesarean section does have remote complications. But the other view is if she is a woman, she has a right on her body, and if she wants to have a cesarean section, it should not be denied.
Gynecologists, they also are anxious and they don't want to take too much risk seeing into too much litigations these days. So one reason is that. The other is from the patient side. The patients, they also have 1 or 2 kids these days. They think cesarean is totally risk free. So and they don't have to bear the pain, of course.
अगर नॉर्मल के इंडिकेशंस है तो हम नॉर्मल ही कराएंगे, लेकिन उस बेबी की जो इम्पोर्टेंस है उसको भी देखा जाता है. तो इनफर्टिलिटी के केसेस में ज्यादातर जो है वो सी सेक्शन प्रेफरेबल होता है.
There is no doubt C-sections save lives when there is a medical crisis, but they could also endanger health if done when they are elective. The lopsided number of C-sections in private hospitals is a major cause of concern. Even when patients and their families push for unnecessary C-section deliveries, doctors need to provide better guidance. The government, on its part, needs to scrutinize data and direct course correction. A Times online report.